the effects of grounding on stomach and intestine. Grounding activates the vagus nerve, which calms, protects, and promotes the activities of the stomach and intestines. Because stomach and intestines are innervated or supplied by the vagus nerve. Among my cases, 6 people said that they overcame the problem of gastritis from which they had been suffering for many years. Now, 2 cases had used to get abdominal colics and wake up around 2 a.m. in the morning if they had bread or anything made from wheat flour for dinner. Now, both of them overcame this problem after practicing grounding. 35 of my cases reported that their waistline reduced with grounding without dieting or exercise. Now, isn't this marvelous? What happens is, if you do not get adequate night sleep, the stomach produces an excess amount of the hormone ghrelin. Now, ghrelin stimulates the appetite center in the brain, which promotes overeating. With grounding, you get adequate sleep. Therefore, there's less production of ghrelin, and hence the appetite comes down. So there's a saying, sleep less, weigh more, sleep more, weigh less. A case of mine demonstrates this very beautifully. A 60-year-old boutique keeper, a male, his height is 5 feet 6 inches. So the waist should be half the height, which his waist should have been 33 inches. But his waist was 40 inches. When I met him one day, he told me, "Doctor, give me a medicine to reduce my tummy." Now, he being a boutique keeper, from 9 a.m. to 9 p.m., he's in the boutique. So I asked him before coming to the boutique around, say, 7 a.m., to keep a chair in his garden, and where the area where you keep the 2 feet, to loosen the soil there and make a dilute solution of salt water and pour on that area, and to keep the bare feet on that area, to keep pressing hard for 45 minutes, to wait like that. Now, in 10 days' time, he told me that his trousers are loose now, and his waistline has reduced 2 inches. And so with it, now see, with grounding, without dieting exercise, his waistline reduced by 2 inches in 10 days. Then also, the important thing he said was, unlike earlier, now he's getting a good night's sleep. And also, unlike earlier, he cannot eat as much as food like before. So this clearly demonstrates that adequate sleep, if you get adequate sleep, you can control your waistline. Then among my cases, 27 reported better control of their diabetes after practicing grounding. I suppose, again, this is because their food intake is reduced, and therefore there's better control of diabetes. Then also, when I went to Peruvian, I met a 47-year-old female. She was suffering from central obesity and fatty liver disease. And she was taking a treatment for fatty liver disease for around 8 months. Then after I advised her, she started to practice grounding. And in 1 month's time, there was a reduction in her waistline. And also she overcame the fatty liver disease. So now fatty liver disease is very common among even the middle-aged people today. So this grounding could be an ideal solution for fatty liver disease. Because if you don't treat fatty liver disease, it will go to the next stage of cirrhosis. Now, in addition, she had varicose veins in her right leg for 22 years since the birth of her daughter. Now, with grounding, these two also disappeared. Another important case is a 67-year-old male who managed to overcome the condition of irritable bowel syndrome, which he had been suffering for over 10 years. Actually, he gave me permission to mention his name. He is Mr. C.K. Basnayaka of Nugegoda, Harankawa. Now, in fact, I also can't believe it, but he says he's the one who had been suffering and he knows what happened to him. And he said with 1 day of grounding, he managed to overcome this problem which he had been suffering for over 10 years. So he was so thrilled with this experience that he managed to overcome this chronic problem. He started looking for patients with chronic illnesses, and he actually, up to now, he had made over 100 grounding equipment and distributed free to them to overcome their conditions. And there are some very important cases which he has given me. There are 2 cases of Parkinson's disease also among them. So I thank Mr. Basnayaka for his yeoman service for my case studies. Thank you very much. I like to talk more on the subject of central obesity, as this is so vital for our health. In central obesity, there is excess amounts of fat deposited inside the abdomen surrounding the various organs. This fat is referred to as visceral fat. Visceral fat is known to act as a factory producing copious amounts of the very dangerous pro-inflammatory cytokines and releasing to the bloodstream to be distributed all over the body. The danger of this is that they promote almost all non-communicable diseases such as cancers, heart disease, diabetes, high blood pressure, dementias, arthritis, etc. I showed earlier how grounding could play a major role in preventing or managing central obesity. A very simple, easy, and straightforward way to find out whether you have central obesity or not is to measure your waist circumference at the level of the umbilicus. If this waist measurement exceeds half your height measurement, you have central obesity. For example, if a person is 5 feet tall, that means his height is 60 inches. Now, if his waist measurement exceeds 30 inches, he has central obesity. As shown in my case studies, grounding could help people with central obesity to overcome the problem. In addition to grounding, if they also could practice intermittent fasting, it will be even more effective in overcoming the problem of central obesity. I like to advise every person over the age of 30 to keep a length of string measuring half his or her height and measure the waist circumference once a month. I consider doing this test once a month to be as important as, or even more important than, your lipid profile, liver function tests, HbA1c, etc. Because if you do not allow your waist circumference to exceed half your height measurement, very likely that all the other tests mentioned above would be normal. Before concluding, I would like to refer to the decrease of appetite brought about through grounding as internal dieting, because the control of food intake happens through your own mind. There's no external pressure. Now, if you In external dieting, you force yourself to restrict the intake of food, and you are craving for that food, but you have to force yourself, and it is definitely a strain on your mind. So, therefore, doing internal dieting with the help of grounding will be the solution. Thank you very much.